Hey folks, Dr. Joe Esposito here. We're going to talk today about breast cancer. Now, the reason we're going to do this is my sister passed away of breast cancer. I have someone in my extended family who did very well and survived breast cancer. And a lot of patients come to us with breast cancer. And a lot of people have questions as to what they should do. Now, I'm not a medical doctor. I'm not telling you what you should do or shouldn't do. What I am saying is these are some of the alternatives and some options that are available to you. And then you can talk to your doctor, your family, your team, and decide what treatment's going to be best for you. And the reason I'm doing this is many times you don't know what options are available to you. You go to one doctor and they say, this is all there is. There's only complementary therapy. There's only IV therapies. There's only surgery. There's only chemotherapy. Not true. There's a lot of options out there, and I want to share this information so that you have a better understanding as to what's happening. Now, breast cancer isn't what it was 20 years ago. The survival rate is climbing, greater awareness, more detection, advances in treatment. There's about 268,000 Americans who are diagnosed with breast cancer every year. So there's a lot of reasons, way more reasons to be hopeful with breast cancer than there is to not be. So doing a lot of things together, if it were me, that's what I would do. I would do a combination of treatments. Now, men get breast cancer too. It's not just women. So it's important that you understand that there's options out there, and they work together very nicely. That's what's good about this. They don't conflict, because people say, like, about supplements. Well, Dr. Joe, if I take nitric oxide, can I take it if I'm taking blood pressure medication? Well, the answer is yes. You can take it because they work together. The nitric oxide opens up your blood vessels, and the medicine can actually lower your blood pressure. The nitric oxide, in many cases, helps lower blood pressure. And then you have to decide what route to go after that. Do you continue with a good diet and supplements, or do you go with the medicine? I've never, in my 37, 38 years in practice, have ever told a patient not to take medication. I can say, why don't we work together with your doctors, and let's try to get the best treatment for you? And that's what we're talking about today. So breast cancer has no symptoms, but it can be noticed. You might notice something that you might want to get checked out by your medical doctor. A painless lump in the breast. Painless is the key there. Remember that. Changes in breast size or shape, swelling in the armpit, nipple changes, discharge. These all can be signs that, you know what, I better go get this checked. And it's okay to go get it checked. I had a toothache the other day. Went to my dentist, and I thought the worst. And he looked at it, he x-rayed it, he took a look at it. He said, no. He says, your teeth are hitting, as you get older, things change in your body. Your teeth are hitting a little bit. Let me just balance out your bite a little bit. And it was done. So it could have been worse. It could have been infection, could have been a rotten tooth, but it wasn't. It was just something minor. So I love testing. I love MRIs, I love x-rays, I love CAT scans, I love all these tests because I like finding out where the problem is so that, or not, so that we know how to treat it. When patients come in and say, Dr. Joe, I've been to all these different doctors, I've had all these different tests, good. Now we know what it's not. Now let's see if we can figure out what it is. And that's how I want you to think about breast cancer. Don't get nervous if you find these things. Let's just go get it checked. Signs of inflammatory breast cancer. It's rare. It's a fast-growing type. It rarely causes a distinct lump. Instead, the breast skin become thick and red and look pitted, kind of like an orange peel. So if you see breast tissue looking like that, it's something you want to go to your doctor about. The area might feel warm or tender, and small bumps, kind of like a rash. So if you have that, like I said, good idea to get it checked. Doesn't necessarily mean that there's a problem. It just means we're going to get it checked. Now, traditionally, the way they test it now is mammograms. I've never had a mammogram. I cannot speak for a mammogram, but it helps with early detection. Now, some people say, well, Dr. Joe, you can use thermography. And thermography is where you measure heat of the body, and you can measure the heat of the breast. And it's an alternative treatment. And sometimes it can spot things really early on. Sometimes it can't. So my approach, my opinion, if I had it, I would do the thermography. And if nothing showed up, then I might consider doing a mammography. Okay? Again, if something showed up on a thermography, we kind of know right away where it is. And then we can kind of go ahead and treat. So it's certainly something to consider, that thermography, although it's not recognized traditionally by National Institutes of Cancer, whatever the group is, it's something that you could add to an alternative complementary treatment. That's what I'm going to use, complementary treatment. You can do ultrasound or MRI. It's kind of like taking a picture inside the body. Breast ultrasound can help you find cysts, fluid-filled sacs, and that most oftentimes aren't cancer. So once again, you may have to do several different tests to try to figure out what's going on. You might get an MRI if you get a mammogram with it as part of your routine tests. Again, these are all things that I find very safe. I don't have a problem with these. The mammogram, there's some questions. Do you squeeze the breast tissue? Can you spread the cancer? I don't know. I don't think there is an answer out there. Some doctors say yes, some doctors say no. That's why I'd say I'd start with a thermography, and if it doesn't find something and I have other symptoms, then I might want to consider it. Now, officially, you should go get your mammograms. That's what I'm going to say is your official statement, because I'm a doctor, I have to follow the rules, but there are other things that might be options to you as well. Self-exams, for years I remember they were teaching it to girls. Do your self-exam, do this, feel underneath. Well, it turns out that these exams play a very small role in finding breast cancer compared to other testing. The current thinking is more important to know your breasts and know if there's any changes. We look at ourselves in the mirror. We look at our bodies. We know as we get older, things change. Some days we feel fat. Some days we feel skinny. Now, you kind of know if something's different. And if it's not just a little bit of aging going on, it's something you might want to do. But breast self-exams really they didn't find a whole lot once they taught them that women were finding or men were finding any issues there. So what happens? What happens? You see something, you find a lump, there's something wrong. Don't panic. 80% of breast lumps aren't cancerous. So you have a very high rate of non-cancerous diagnosis is coming in here. It often turns out there's harmless cysts, there's tissue changes, sometimes related to the menstrual cycle. Let your doctor know right away if you find something unusual. And if it is cancer and it's found early, it's better to treat it. Again, we talk about this all the time. The earlier we can get to finding anything, the easier it is. Now, my team of doctors, chiropractors, pain management doctors, nutritionists, we rather get to the patient when it first happens. And we have patients come to us all the time, just like breast cancer doctors do. And they say, gosh, Dr. Joe, I've had this pain for 20 years. What'd you do about it? Nothing. I had one epidural. It helped a little bit. Then the pain came back. It didn't do anything. So the earlier we can detect anything, the better off it's going to be. So when patients have neck pain and back pain and shoulder pain and numbness and tingling, if you're in a car accident, you have an injury, hit your head, come see us for that. Don't come see us if you find something with your breast. I'm just letting you know there's options out there, but that's not our field. That's where you want to go to a specialist. We're specialists in pain management, neck pain, back pain, shoulder pain, nutrition, digestive issues. My team of doctors are really good at that. So if you find something, you want to know what doctor to go to. In fact, we're putting together a group. It's called Health Plus Connections. And it's not just doctors. This could be anyone in the health field. It could be a therapist. It could be somebody who does carpet cleaning or natural house cleaning or oils that may help, make the house smell nice. So we're putting together a group of people that are interested in health, not necessarily medical, but health, and it's going to be a referral network. So it's called Health Plus Connections. It's not out yet. Just letting you know it's happening. I'm still working on it, getting all the paperwork done. And so when it happens, I'll let you know. We were going to consider putting restaurants in there. People that have good choices of food that I would go to. I'll say, okay, listen, why don't we add that as well? So just letting you know, because I get the question every day, Dr. Joe, who do I go to for blank? Many cases, it's us. It's my team of doctors. But something like abnormal breast tissue, that's when you want to go see a breast specialist. Now, there's different things you can do, like we talked about testing, and a biopsy really is the ultimate test. It's the only sure way to know that you have a cancer. And what they do is they remove a little sample of the lump, and your doctor can do this usually with a small needle. You might need surgery to take part of the lump out for testing. It depends on where it is and how it's locked in there. The results will show whether or not it's cancer, and if so, what type, because there's different types of breast cancer as well. And each one has to be treated differently. You don't treat breast cancer across the board the same way. So let's talk about that. There's hormone-sensitive breast cancer. This I want you to understand because this is something that you have control over. It's somewhat, not totally. Some types of breast cancer are fueled by hormones like estrogen and progesterone. Your doctor tests the hormone receptors. These are proteins that pick up the signal from the hormones, and they tell the cancer to grow. A biopsy can show if the tumor receptors are receptors for estrogen, it's called ER, like estrogen positive, or progesterone, PR positive. And about 2 or 3 breast cancers are hormone sensitive. Several medications help keep the hormones in check. But what I want you to do, again, this is in conjunction with your medical treatment, I want you to avoid the things that are estrogen or act like estrogen. So where might I find estrogen? Well, animal products. If you're eating meats and dairy products, they have estrogen in them. And the reason is estrogen is a growth hormone. And especially dairy products is loaded with estrogen-like compounds because it makes the cows grow. It's a growth hormone. So one thing I'm going to suggest, in addition to your medical treatment, not instead of, is I really recommend that you cut out all your animal proteins. And there are many studies out there that show when you cut out animal proteins, it reduces your risk of cancer. It doesn't eliminate it, but it reduces it. But to me, logically, if I had estrogen positive breast cancer, I would want to stay away from things that are estrogen laden because estrogen causes it to grow more. So animal protein's a biggie, but there's also something called endocrine disruptors. Endocrine disruptors are chemicals that act like estrogen. And that might be phthalates. Phthalates are many times are found in perfumes, hairsprays, shampoos, conditioners, carpet cleaners, house fragrances, things you plug in the wall that make the house smell nice, new car smell. Anything that has a smell to it, almost anything, an unnatural smell, can have endocrine disrupting chemicals in it. And it can act like estrogen. Now, is that going to cure your cancer? Probably not. Is it a good idea to add it to your protocol? In my opinion, yes. Why would you do something that puts you at risk if you already know you have, let's say, estrogen positive breast cancer? Stay away from those things. Microwaves. You put plastic in a microwave and heat it. When my sister had breast cancer, I remember she would take marinara, red sauce, Italian sauce, put it in a plastic container with meat in it and put it in a microwave. And I remember saying to her, Sue, maybe that's not the best idea. Oh, that's, what you're talking about. Let's assume I'm wrong. Let's assume that eating animal products and estrogen and phthalates and estrogen and endocrine disrupting hormones have nothing to do with breast cancer. So what? If I'm wrong, I'm wrong. But if I'm right, then you did something positive. There's no downside to being cautious when it comes to these things. And that's what I want you to think about. If there's no downside to it, only an upside, why not do it? Why eat meat and dairy products? I mean, I don't eat meat and dairy products, but why eat them if there's a risk? Why use a microwave if there's a risk? I could heat it up on a stove. There's other food I can eat. It's not like it's the only option. There are plenty of options out there. And so just make better decisions and err on the side of caution. Because if I'm right, great. And if I'm wrong, there's no downside. If you go to Las Vegas and you place a bet and you can only break even or win, would that be a good bet? Absolutely. But if there's a chance of losing, well, then there's a risk involved. But if you break even or win every time, why not take that bet? I would. That's how I want you to think about this. There's no downside to not eating meats and dairy products. There's plenty of foods out there. We know the longest living people in the world eat a plant-based diet on average. So why not go to that? I'm not saying it's a cure for cancer. I'm saying it's certainly I would take it as I would not take the chance if I had these issues. Now, I don't take the chance anyway. I eat a plant-based diet anyway because it just makes sense to me. And every research article I've ever read points to it's positive, maybe it's neutral. Nothing have I ever read anywhere that says eating a plant-based diet has negative impact on your health. Never read it. And I read all day, every day. And I've yet to see it. And so there's no reason to take that risk, especially if you have breast cancer. There's also another type of breast cancer. It's called HER2 or HER2 positive. About 20% of patients with breast cancer, their breast cancer cells have too much of a protein called HER2. And this type, they're called HER2 positive or HER2 positive, and it tends to spread faster than other forms. It's important to know whether the tumor is an HER2 positive or HER2 positive because there are special treatments for that type of cancer. That's why you want to get a good diagnostic and find out what you have. So breast cancer is measured in stages, 0 to 4. And they describe whether the cancer is only in the breast, has it moved to the lymph nodes, or has it spread to the organs like the lungs. Knowing the stage you're in is going to help the doctors that are treating you come up with a better treatment plan. Now, that's why you want to get to things early. Now, I talked last week about not being a taint nothing patient. And if you don't know what a taint nothing patient is, when a patient says, Doc, I've had headaches for 5 years, taint nothing. No, it is something. is something very serious. Yeah, but I just take some aspirin, I deal with it. One of my colleagues I work with, he takes aspirin every single day, and if he stops taking them, he gets rebound headaches. I think he takes ibuprofen. I'm not sure what he takes. But he takes an over-the-counter medication. And if he stops taking them, he gets a rebound headache, which means when you stop the medication, the pain comes back with a vengeance. It comes back stronger. And so he just continues taking them. Now, I like this guy a lot. He's a very good friend of mine. I think he's brilliant. But I'd love to work with him and see if we can get him off his medications. Again, don't stop taking the medication. Let's work with the patient to try to get them well enough that they don't need the medication. And that's always our approach. So I'm going to put my plug in now. I'll go back to cancer in a second. If you have health issues, neck pain, back pain, shoulder pain, headaches, numbness, tingling, muscle weakness, digestive issues, nutritional concerns, come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And my team of doctors would love to be your doctors. We'd love the opportunity to work with you to try to get to the cause of your healthcare problem and not just treat the symptoms. And in most cases, when it comes to back pain, major majority, the cause is a bone out of place, pinching a nerve, swelling in the spine, swollen discs. And my team of doctors are really good at dealing with that. So if you'd like to make an appointment in the Atlanta area, you can go to drjoe.com. That's our website, drjoe.com. And you can book it right online. You can call us. The number's all over the website. You can call us. We're happy to set you up an appointment as quickly as possible. Sometimes we can do it same day, 24 hours, 48 hours. We can usually do it pretty quickly. The initial visit is normally $712. Now, for our listeners, we've reduced that price to $299. And I know that's crazy. But that's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. The x-rays alone, anywhere else, is going to cost you more than $299. So we want to make it so that you can come in and we can see if you have a case that we think we can help. And if we can, we'll tell you. If we can't, we're going to say, listen, you don't have a case that falls within our scope of practice, our wheelhouse. We're going to send you over here to some other doctor, some other clinic, some other treatment center, so that you can get the best treatment possible. Now, many cases, we co-manage the case. And that's what we're talking about here we're talking about breast cancer. I don't want to treat you for breast cancer. I can't treat you for breast cancer. But I can help your body get healthy enough so that you respond better to the other treatments. That's something we're really good at. And that's why we work so closely with other doctors and hospitals and nurses, and why we have referral systems back and forth, because hospitals many times refer within the hospital. You're a doctor on staff, and they refer to the doctors on staff. And they keep it's an incestuous little referral network. But we've broken through a lot of these little incestuous referral networks and said, wait a minute, we can offer you something no one within your network can offer. So can you add us to your referral network? And sometimes the answer is yes. Sometimes it's no. I know we had an attorney the other day, and I met with him, and he says, well, we don't really refer our cases out to chiropractors because your bills aren't high enough. I said, what? He said, your bills aren't high enough. And I've heard this before. He says, we want those $50,000, $100,000, $200,000 bills from the surgeons. That's what we're looking for because we get better settlements. I said, but what about the patient? Maybe they don't need surgery. Maybe they don't need all these extended treatments. Maybe they need chiropractic care. Well, our job is to get the biggest settlement possible for the patient. And I found that interesting. It wasn't about the patient's health care. It was about getting the biggest settlement possible for the patient. Yeah, you can make $100,000, put it in your pocket. But you have permanent damage from your spinal injury. Is it worth it? No, it's never worth it. And you got to remember something too, folks. When you see these attorneys advertising on TV that say, we got a $500,000 settlement for Bob, the attorneys get at least a third, sometimes 40% of that. Then your bills have to come out of that. Then the expenses come out of that and court costs. And if you do depositions, and there's a lot of money that comes out of that, quote, settlement. I want to see them say, this is how much the patient got. Big difference, huge difference. So if you're in a car accident, we'd love to treat you. We try to get to the cause of the problem. And if you need other treatment, we're happy to see you. But anyway, if you want to make an appointment, drjoe.com. All right, so treatments, of course, there's surgery available. Many types of breast cancer surgery, they can take out the lump. Again, we don't do that. That's not our job. They can remove the whole breast, which is a mastectomy. There's radiation treatment. Radiation kills cancer cells with high energy waves, and it can be used after breast cancer surgery to wipe out any cancer cells that might be at the site. Now, it's come a long way in the past 20 years. They used to just radiate the heck out of everything, and hopefully they can get the cancer cells. Now they're focusing a lot more specific as to exactly where they want to focus the radiation. But the key is, if you have chemo, if you have radiation, if you have any type of surgery, you want to get as healthy as possible going into the surgery and as healthy as possible coming out of the surgery. So I'm not saying don't do the surgery. What I'm saying is let's get you healthy so that you do better. And we have doctors now, orthopedic surgeons especially, can send us patients, because I meet with them and I'll say, listen, there's a lot of patients that are so sick, they can't have surgery. They say, oh, it happens all the time. They're so sick. I said, why don't you send them to us? Let us try to get them well enough to have surgery, and then we can send them back to you and you can do the surgery. Surgeons love the idea. I said, there is a risk involved. The risk is they may not need the surgery when we're done with them. And they always say, smart ones do, say, well, it doesn't matter because we're not going to operate on them anyway. The insurance company isn't paying for it. Patient can't afford it. So we're not going to operate them on it anyway. Go have at it. And so there's options there when you're not healthy enough to get well. I kind of laugh at that statement, but the insurance companies decide that. The risk is too high. We're not going to pay for it. Come see us. Let's see if we can get you healthy enough to have the surgery or maybe not need the surgery. Either way, I'm fine. Either way, you're fine. Either way, the surgeon's fine. Nobody loses in that scenario. So that's what we try to do in our office. We work on the nervous system, we work on the digestive system, and we work on your diet. And we try to get you as healthy as we possibly can for the next phase of your healthcare treatment. Sometimes there is no other phase. Most times there is no other phase. We're the end game. If there is other treatments, we love to co-manage the cases. So we'd love to see you as patients. So other treatments, again, chemotherapy, of course. Chemotherapy, sometimes it's given IV, sometimes it's oral. So there's a lot of different types of chemotherapy out there. There's the big treatment now in cancer, which I'm real excited about, is immunotherapy. And it turns out your body's own defense fighting powers can be turned against the cancer. I like this approach. There's drugs called immune checkpoint inhibitors, and they target certain proteins and immune system cells. It can make it harder for the cancer cell to invade and attack, and immunotherapy sometimes is used to treat advanced cancers. Now, I like the fact that we as a society are looking at the immune system to try to help the body get well. If I did a great show, it's on the website, drjoe.com, and it's on immunity. You could just type in immunity in the search bar on the website and listen to the show. Once again, I'm not saying I have a cure for cancer. I'm saying these are things we can do in addition to the other treatments. A little later, I'm going to talk about what's the difference between breast cancer treatment, conventional versus natural. We're going to talk about definitions and how they all come together and work together. And it's not just breast cancer. It's all healthcare. I shouldn't even say just cancer. Anything healthcare, we can work with our colleagues to get the best results possible. Even the VA now. If the Veterans Administration refers you to our office or any chiropractic office, they will pay usually the first 12 visits, 100%. Because the VA, after people like myself screaming and yelling and jumping up and down, tried to convince them that it's cheaper to send them out to us than treat them in-house. And they did. And now we get VA patients all the time. Folks, going to have to go to a break real soon. If you have any questions, you can send them to me through our website, drjoe.com, drjoe.com. A little bot pops up. Send me questions. We'll answer them as quickly as we can. If you want to make an appointment, drjoe.com. You can book it right online. You can call us or do it right online. We accept people with all insurances. Sometimes it's in-network. Sometimes it's out-of-network coverage. Sometimes there's no coverage. We'll work with you based on what insurance you have. If you're ever in a car accident, again, please come see us immediately. Don't waste time. Car accidents, sports injuries, the longer we wait, the harder it is to treat that. And again, the website, drjoe.com. If you're a podcast junkie, go to Dr. Joe for the health of it on your podcast service. Hey folks, Dr. Joe Esposito here. Glad you could be with us. What we're talking about today is breast cancer. And it's not just breast cancer, it's all health problems. But I'm focusing specifically on breast cancer because I lost my sister to breast cancer. And I mentioned that when she was going through her treatments, I tried to give her a little advice. But some famous man once said, no man's a prophet in his own hometown. And Joey doesn't know anything. Now, could it have changed the outcome? I have no idea. But I know that when I was visiting her, she was eating bad food. She was doing dairy products. She was eating meat. She was microwaving stuff in plastic. Would that have made a difference? I have no idea. But as I said earlier, I wouldn't take that chance. We know that a lot of breast cancers are responsive to estrogen, and we know estrogen can be found in animal products. We know plastic can create endocrine-disrupting hormones, which can act like estrogen or progesterone. And so I would do everything I possibly could to avoid the things that might make it worse. Now, some people say it does. Some people say it doesn't. I wouldn't take the chance. The analogy I used earlier was if I'm in Las Vegas and I'm going to place a bet and I either break even or win, am I going to place that bet? All day, every day. I can only break even or win. So with changing your diet, with changing your lifestyle, changing your environment, you break even or you win. There's no downside to eating poorly. At the break, I was just talking to Joe, my producer, and he said that his wife gets a newsletter from her doctor, and the doctors, they do what was it, Joe, an ultrasound?
Yeah, an ultrasound.
Why don't you read the quote? You got it right there?
Oh, I closed it, but it was talking about the countries with the least prevalence of breast cancer are mostly plant-based diets.
Yeah, there you go. So this is from Joe's wife's doctor saying that, there you go. So it's not like you can argue these points. It's not like saying, no, you need to eat more meat if you have breast cancer. No, everyone agrees that it's certainly not harmful to eat a good diet, to take supplements. So why not do that? Now, as far as supplements go, I can't say there's a specific protocol for cancer and supplements. But the supplements I take every day that I know are going to keep my body as healthy as it can be are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I mix them together, coconut milk, almond milk. I had a frozen banana with mine this morning, whipped it up into my little Mighty Vitamix, whatever it was. And I have that every day. If I travel, I take it with me. Couldn't imagine not taking that. Vitamin D. A lot of people don't talk about vitamin D when it comes to health, but vitamin D has been shown to help in certain cancer patients. It's not going to cure the cancer, but it's part of the protocol, which we're going to talk about in a second. So vitamin D is very important. I take 5,000 international units a day, which is 5 drops of vitamin D. Now, on the website, drjoe.com, we have the Super Greens, we have the Essential Source, we have Dr. Joe's vitamin D. That's the one I take. I just want to make sure it's vitamin D3. I'm a fan of D3. I'm not a fan of vitamin D2. It's synthetic. So this is what I would do. This is my opinion. I'm not saying I have a cure for cancer. I'm just telling you this is what I know. I would take glutathione, which helps my liver, which I take every day anyway. I would take probiotics, which helps my immune system. Take that every day too. I would eat a plant-based diet, which is what I do every day too. Because there are things you can do to reduce your risk. Is it going to solve every case? No. But study after study show it can reduce your risk. So I want to follow science and do exactly what the science says. So if you're like most women, we're going to talk a little bit more about breast cancer now. You've recently gotten a diagnosis of breast cancer. You're probably learning that everything you can find out. You're going on the internet, you're talking to friends, you're talking to doctors, and every treatment, every side effect, and there's a lot of information out there. You might call friends who may have had it. You hear people have horror stories about radiation, chemotherapy, surgery. You read the side effects, and they were scary. Many women wonder whether natural or alternative treatments are for them instead. Now, if I had cancer, I would follow the conventional protocols, and I would do the natural treatments as well. I would do both. Because I know that if the cancer treatments, whatever they are, if it's chemo or if it's radiation or whatever, they're going to make my body weak. And many times people don't die from cancer, they die from the treatment of cancer. And so I would try to do everything I possibly could to increase my odds of doing well. And people respond better to treatments when they're healthy. I know that sounds almost silly because when I have cancer, I'm not healthy. I know, but let's do everything else we can to keep you healthy. So it's normal to want to explore all these options. People come to me all the time, and I always tell them I am not a medical doctor. I cannot give you advice on cancer. I can give you advice on how to keep your body as healthy as possible. I'm really good at that. And so that's why people come to us. Friends may recommend you try alternatives, vitamin infusions, instead of conventional treatment. Or on the other hand, loved ones may be alarmed. You're considering rejecting conventional treatments. I'm not an MD. I said that. Patients sometimes come to us for second opinions. In fact, patients come to us constantly for second opinions. Will the chemo work? Will it kill good diets? Will kill good cells? Will diet help? Should I use medical marijuana? Should I use IV infusions of vitamin C? The answer is probably all of those, along with your conventional treatments. Now, you can incorporate supportive care therapies, many of which are called natural ones, in an integrative approach to cancer. That's what I'm talking about, integrating your approaches. Help patients manage their side effects with cancer. We're good at that. We can give you nutrition. We can give you chiropractic care to help relieve pain, to increase circulation. We can talk about dietary changes. We can see if the stomach is digesting food properly. Maybe your stomach is pushed up against your diaphragm, and we can pull it back down. We can physically adjust the stomach in many cases. Not all, but many. The standard of care treatments that are out there, whether it's conventional or alternative or natural, each one has their standard of care. I say do it all, because there's no downside to being healthy. There's no downside to keeping the body flexible, keeping the nervous system working. So that's the approach I like to look at. Many patients are unaware that conventional breast treatment cancer, it's come so far in the past few decades. It's not what it used to be. Not everybody needs chemo. Not everybody needs a mastectomy. Not everybody needs radiation. The radiation and surgery procedures are so much more precise than they used to be. And that's something that I'm very happy to see, and it should. We should evolve in healthcare. As a chiropractor, I've been doing this 37 years. I learn new things every single day, whether it's about nutrition, about supplements, about chiropractic adjustments. We have 5 doctors on staff. So there's clinics that you can go to. I won't say the names, but it sounds like one is a condiment in Wisconsin. And you can go there, and they have a team of doctors working on your case. And so they sit down and they meet with a team of doctors and they say, okay, Joe Esposito has this condition. Let's throw it out there, get some opinions. That's what we do in our office. We sit down with our patients, and if there's a case that one of the doctors is not stumped on but might just be confused on, hey, Dr. Joe, come here. Dr. Amy, Dr. Kat, Dr. Irwin, come here. Dr. Chris, come here. Look at this. What's your opinion on this? And then we put our brains together, just like these big fancy clinics do, and we come up with the best course of treatment for that specific patient. And patients say, I've been to these clinics, and they didn't help me. Well, let's look at healthcare in a different light. Let's check the nervous system. Let's check the nerves that feel pain. But here's the thing, 90% of your nerves don't feel pain. You can have a pinched or a malfunctioning nerve and not know it. For example, you don't feel your blood pressure. You don't feel your spleen. You don't feel your kidneys. You don't feel your prostate. So we have ways to test the nerves that don't feel pain. So we can get to the cause of the problem, not just treat the symptoms. And that's what we're talking about today with breast cancer. Let's try to get to the cause of the problem and not just treat the symptoms. I'm okay treating the symptoms, but not just treat the symptoms. Let's get to the cause. So even if you need some of these standard treatments, shortened treatment periods are around now, much shorter than they used to be. Reduced dosages are being used, they're targeting, and much better than it even was 10 years ago. So I'm really happy with the progress that's occurred in breast cancer treatments. Again, my sister, I lost her to breast cancer. I have an extended family member who survived breast cancer, is doing very well. So what exactly do we mean with the words natural, alternative, and conventional? Let me make sure you understand what we're going here. So before we go further, I want to define those. So the National Cancer Institute provides these definitions. Standard treatments are based on scientific evidence from research studies. Here's the thing with research studies. There's a study out there that's going to cover both sides of anything. We'll talk about breast cancer, of liver problems, of chiropractic care, of surgery, of ophthalmology. There's going to be pro and con studies out there. You have to know enough to look at it and say, okay, who paid for it? What is their end game? What are they looking for? Was it done properly? Maybe there's a glitch in the process, and that's why we have peer review. Other doctors review this and ask those same questions. Now, sometimes it's not very clear who paid for it. It might have been paid for one company, paid another company, paid another company, paid a nonprofit, and it looks like the nonprofit paid for it. So research, I remember reading somewhere that whoever pays for the research gets the answer that they want. So let's look at everything and let's see what's out there. So standard treatments are based on scientific evidence. Alternative medicine refers to techniques that are used instead of standard medical treatments. Complementary medicine refers to options that are used with standard medical treatments. That's the one I like. I like the complementary ones. Integrative medicine is a total approach to care that combines standard medical treatment with complementary and alternative, what's called CAM, complementary alternative medicine. These are practices that's been shown to be safe and effective in attempting to address mental, physical, spiritual aspects of a patient health. So that's integration. And that's a lot of what we do in our office. We're a chiropractic team, but we work with medical doctors. We work with pain management doctors. We work with cancer doctors. We work with gynecologists. We work with dentists, ophthalmologists, because we want to work together in an integrative way to get the best results possible. Yeah, I want the best results for you, but you know what? I want the best results for me. I'm a patient too. And I have health problems, just like everybody else has health problems. And I want to say, what's going to be the best treatment for me? And I'm always searching new things. In fact, we just added acoustic wave therapy to our treatment protocols. Acoustic wave therapy sends sound waves into an area, and it stimulates new cell growth, breaks up scar tissue, stimulates new blood vessel growth. It's amazing for knee issues, foot issues, plantar fasciitis, shoulders, spines, knees. Ultimately, we'll be using it as we get a nurse practitioner on board for erectile dysfunction, urinary women that pee when they laugh and cough. We can use it for that as well. Aesthetics, cellulite. They can be used for cellulite. It can be used for facials. There's so many different protocols that you can use acoustic wave therapy. It's relatively new, especially for these fields that it's being used with. It originally was invented to break up kidney stones. They'd send sound wave therapies into people's kidneys and break up the kidney stones. Well, they found out if they alter the sound wave a little bit, it can be used for orthopedic and for aesthetics. So we're always looking for new things. And so we're looking for the best way that we can treat you and the best way to treat me. So standard treatment, also known as standard of care or conventional treatment, includes therapies like chemo, surgery, radiation, precision medicine. So that's really cool. So again, cancer treatments come a long way. When patients talk about natural, they're usually referring to complementary therapies or alternatives, botanicals, dietary supplements, acupuncture, cannabis. You can do this in addition. They say, well, it's not proven, but it's not going to hurt you. The Hippocratic Oath that doctors take, I don't know if they still take it, they used to take it, is Hippocrates said, above all, do no harm. Remember that. Above all, do no harm. And so if these things are not going to do any harm, that's awesome. Let's incorporate it in there and let's see what happens. And the reason I say this is I've had a lot of patients come to me over the years, and some unfortunately have passed away, but many of them have gotten amazing results. I have one patient now. We have several patients with kidney issues, but she was told, game over, stage 4 kidney failure, you're done. She came to me, she sat down, she cried, and she said, I don't know what to do. She said, I'm at my wit's end. The doctor said I'm going to die. I'm willing to do anything you say. So I said to her, listen, what do we got to lose? And she agreed with me. What do we got to lose? So we got her on a plant-based diet. We got her on supplements, got her on chiropractic care, and her kidney function, don't quote me on the exact numbers, went from 28% to 39%. Her doctor said, this is amazing. Kidneys don't get better. What are you doing? Well, I'm doing what Dr. Joe said. I'm doing supplements, doing super green essential source, nitric oxide. We got her on kidney supplements. And he said, whatever you're doing, just keep doing it. Because I don't see patients get well, and I'm seeing you get well. This is her doctor speaking. So just keep doing it. Isn't that exciting? Now, I wish he would send us all the kidney patients and we could work together, but he hasn't gotten to that evolved state yet. But hopefully they will. So there was nothing that could have been done for her. So we did this and it worked. And she's walking better and she's laughing and she's cutting up and she's talking dirty. And I mean, it's a lot of fun actually to see her evolve from this person who's basically on death's door. And we see that all the time with patients. So it's really exciting. Now, you can use a team of clinicians using standard treatments to treat the cancer, and then using evidence-based information, supportive therapies to combat the cancer-related side effects, the fatigue, the weight loss, the digestive issues, the loss of appetite. Many times cancer patients just don't want to eat. So I'll say, listen, at least get them super high concentrated nutrients. It's not going to hurt. And so I get them on things like Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Nitric Oxide support, Dr. Joe's the glutathione. We get them on probiotics to build up the colon because many times the chemo kills off good bacteria in the colon. We get them on vitamin D. And we try to, and that's a protocol I take myself, everything I just said right there, I take every day too, as a prophylactic measure. Am I saying I'm never going to get sick? No, of course not. but I'm going to do everything I can to keep my body as healthy as possible so that should disease come my way, I can fight it off better, healthier. Chiropractic care. Who would ever think of chiropractic care for cancer patients? I'm not saying it's a treatment for cancer. I'm saying so many times patients are in pain when when they have cancer. Chiropractic care many times can relieve the pain, the neck pain, the back pain, the shoulder pain, the numbness, the tingling. Chiropractic care also opens up nerves and blood supply so the body functions more efficiently. And it's sad when people come to us, sometimes they come too late. I've been meaning to come here, doc, forever, and I just haven't gotten there. Now I'm at wit's end. What can I do? And the biggest complaint I get, been doing this for a long time, biggest complaint I get, why didn't I do this sooner? Why didn't I get treated sooner? Why did I suffer so long? So if you have a health problem, neck pain, back pain, shoulder pain, headaches, digestive issues, nutrition issues, you want us to co-manage your case with your doctor, whatever you're getting treated for, we'd love to treat you. We'd love to see you as a patient. So you can go to our website, drjoe.com. You can make an appointment. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And you can book an appointment right online. You can call us. We are more than happy to set you up a time. The initial visit normally is $712. For our listeners and their friends, we've reduced that to $299. That's an exam, x-rays, consultation, first treatment, next visit going over the x-rays, and a complete nutrition evaluation. The x-rays alone anywhere else are going to cost you more than $299. We accept most insurances. If you're out of network, in network, we try to work with the insurance companies and your co-pays the best we possibly can. We accept Medicare, car accidents. I teach other doctors how to treat car accident cases. So you're coming to the person who teaches the other doctors how to do it. Medical, chiropractic, physical therapy, therapists, lawyers. So drjoe.com, make an appointment right now. Please come to see us as quickly as you can after a car accident. There are a lot of scammers out there. There are a lot of doctors and lawyers that are out there just running up bills. I don't want you to fall victim to that. Come see us, drjoe.com. We'd love to see you as a patient. So we're talking today about breast cancer and alternatives and complementary and other things that are available to you, not instead of conventional treatment, in addition to conventional treatment. Research shows that patients who choose complementary medicine only may be more likely to avoid conventional medicine, and that can be, cancer is one of those things you got to get to quickly. If cancer continues unchecked, it's kind of like a house fire. So try to treat it with solely natural things might not put the house fire out. You're trying to put the house fire out with a water hose. Sometimes you need everything together. And that's the approach we like to take. So whether it's localized breast cancer, it can progress to metastatic cancer. Sometimes cancer is too far gone. You can't always get to it, but these are the things you can do. So the advances in conventional breast cancer treatment: early stage localized breast cancer, highly treatable. Not everyone is aware that treatment in general has evolved so much. We still think of it as what our grandmother had it and how far it's come. It's come a long way, baby, as a Virginia Slims commercial used to say, which ironically caused a lot of cancer. Surgery: women who have been diagnosed with breast cancer assume that the mastectomy is the only treatment. Not necessarily. There are other things we can do. There's radiation. There's precision medicine. There's chemo. So how do you combine your conventional and your alternative medicines and your treatments? So supportive care modalities, like I said, nutrition, therapy. There's an emotional component when you have cancer. So it's very good to get counseling for that. I support that 100%. I wish everyone in the world would just accept counseling and do it. I think it's great because we're not taught a lot of things in life. I always said if I was Grand Poobah of all the school systems, I would teach 3 things. I would teach how to make money, how to have a relationship, and how to take care of yourself from a health standpoint. Those are 3 things we all need to do every single day. And not necessarily a boyfriend-girlfriend relationship or whatever your choices are, but how to have a relationship with your coworkers, how to have a relationship with your friends, with your children. So I think that's important. And the thing that, of course, I think I would definitely control would be teaching healthcare. And not just public health like you taught in high school, actual healthcare. What to eat, what not to eat. How does the nervous system work? What are the best supplements to take? That's what I think everybody should do. And that's what's great about doing this show, because I get to tell you these things. I can't control the public school system, but I can help you, if you're interested, learn about that. Now, if you want to learn more, I'm almost out of time. If you have a desire to learn more about healthcare, you can go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. And we have hundreds of hours of podcasts on whatever your podcast service is. On our website, drjoe.com, we have over, I'm going to guess 3,000 hours of podcasts, audio and video, because some people are visual learners. So we videotape a lot of our podcasts, and we have them available for you as well, so you can see and interact. If you want to make an appointment, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. And we can be your primary doctors, or we can co-manage your case with other doctors. Maybe you're with a surgeon. Maybe you're with an oncologist. Maybe you're with a therapist. We'd love to co-manage cases. And we have a very good relationship with all other professions. Everyone loves us. We love them. We want to work together to get you the best results. Again, the first visit, normally $712. We've reduced that to $299 for our listeners and their friends because we want to show you, we want to get you in so we could say, yes, we think we can help you, show you what we found, or find out this is not a condition that we can treat. Let me give you a referral to somebody else. We want to get the best results that we can for you. Maybe it's, like I said, maybe counseling, maybe it's spiritual support, pain management. As far as I know, I'm the only chiropractor in the state board certified in pain management. I'm also board certified in orthopedics, non-surgical orthopedics. I'm double board certified in nutrition. Got a lot of 5 board certifications. That's a lot. And so we take all that information and put together protocols specifically for you. And the pain management portion, when it comes to breast cancer or any cancers or any condition, we're really good at that. Sometimes you need injections. Sometimes you need a hyperbaric chamber. Sometimes you need medication. We have doctors that we work with for that. So the ultimate would be a normally functioning nervous system, a normally functioning digestive system, and good nutrition. That's like, I was thinking of it like a stool with 3 legs. That's enough. That's the starting point. Now we can add other things to that if we need to, but without those 3 supports, you're probably not going to get all the results that you want. So if you don't know what to eat, go to our website, drjoe.com, type in the words, so what can I eat? Listen to the show we did on So What Can I Eat? It wasn't even a show. It was just me talking for an hour. I've written books. I've written Eating Right for the Health of It. I've written Prescription for Extreme Health. Those are on the website as well, drjoe.com. Supplement-wise, I think the minimum supplements everybody should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I mix them together, coconut milk, almond milk, water, whatever you want, smoothie. Take it every single day. I take vitamin D. Unless I'm out in the sun for about a half hour a day, 20 minutes to a half hour a day, I take vitamin D on that day. I take 5 drops of Dr. Joe's vitamin D. Vitamin D3, not D2, should also have vitamin K2 with it because vitamin D3 does a lot of things. One of it is absorbs calcium into the body. K2 drives it into the bones. D3 without K2, I don't think is a good idea unless you had a really, really good diet. I eat a good diet and I still take it. If you have any questions, send them to me through the website, drjoe.com. I'm more than happy to answer your questions. We have a live event coming up, so follow us on social media at Dr. Joe Esposito. We're giving away free tickets to a live event coming up at Dr. Joe Esposito. Folks, I'm Dr. Joe Esposito, drjoe.com. Catch you next time.